So these are some of the courses by Ayurveda MAC. First one is Thanika Chikitsa in Stri Roga. It's a 3 months duration course. Next one is Diploma in Ayurveda Cardiology. It's a 6 months online training program. Next one is Postgraduate Diploma in Sports Medicine and Rehabilitation. It's a 6 months course. Next one is Diploma in Antenatal and Postnatal Care in Ayurveda. Next one is Diploma in Ayurveda Cosmetology. Next one is Professional Diploma in Ayurveda Panchakarma. Next one is Ayurveda Product Making, which includes kajal, soaps, etc. Pre-booking for PG Diploma in Ayurveda Cosmetology and Ayurvedic Nutrition has started. So courses will start in May 2026. Today's topic is how to assess Samyak Lakshana of Panchakarma procedures, session 2. And our faculty is respected Dr. Ramya Alakan. I would like to extend a very warm welcome to Dr. Ramya. Welcome, ma'am. And I welcome each and every one of you to this session. Thank you, ma'am. Over to you.
So once again, a very good evening to one and all. Dear Dr. Anupama and all dear doctors. So, Chaturmukha Samarambam, Aghadacharya Madhyamam, Asmadacharya Paryanta Vande Guru Parampara. Ragadirogan, Satitana Shaktana, Sheshakaya Prasadana, Sheshana, Utsukya Moha, Ratitan Jagana, Yopurva Vaidyaya, Namostu Tasme. So, today, in continuation with our previous session, we are actually discussing Samyak Lakshana assessment in clinics actually, with special reference to Vasti, Nassim and Murda Dailam. So as I mentioned, what is the relevance of these Lakshanas is basically, actually when we are planning for a procedure, the response of the procedure that is making in the body, and then how long or how modulated that we need to continue the procedure. All these things per se pertain for our observation with respect to Samyak Lakshanas only. So with our clinical observation, we had seen actually with respect to Nasvasti, there are many things that we need to observe. Like many a times what happens is whenever we are speaking about Vasti, patients, once patients are undergoing treatment, a doctor goes for rounds and they ask whether, did you pass motion? Yeah. How many times? 2 times, 3 times? Fine. That's the end of the Vasti assessment. But when it said Prasrishta Vinmutra Samiranatvam Ruchi Agnivruddhi Ashelagavani Kabandam to be the end point, all these things are never observed. Actually, it is these things that need to be observed and the procedure of the Vasti being regulated according to the clinical condition as it comes out. So I think concentrating on that area, we will be discussing today's Samyak Lakshana assessment in clinics with special reference to Vasti Nassim and Murda Dailam. So first we will take on Vasti. Okay. Now, when a patient comes to us, actually our questions in front of us would be, is Vasti actually a choice in our treatment? The second would be, should I start with a Vasti or should I actually end the treatment with Vasti? Okay. So when the patient is getting admitted, should I first start the treatment with a Vasti or should I go for a Dhanyamladhara or Rukshana, then Snehana, then end and then Avirezana, then end with a Vasti? These answers are very specific actually. If yes, now if we plan for a Vasti, which is the best, how much should we do the Vasti total quantity? So these are all the specifications that we need to work upon. And when we are doing the procedure, what happens? Some issues that we commonly face is if the medicine does not come out, what to do? Where has the medicine gone if it's not come out? How long practically? Of course, for Niruddhavasti, it's Manmuhurtam, and for Anuvasnavasti, it's 3 yamam that we have to wait. But if the medicine does not come out at all, then what should be our next step? Does that affect any kind of where are we going to assess Samyak Lakshana at that point of time? And what is the role and how these can help us to make a decision? Now, clinical challenges, if severe headache happens immediately after Vasti, what to do? Why did that happen? And if the patient vomits after Vasti, or the patient faints or loses consciousness, what to do, how to analyze, what could be the cause and why this has happened. So these are our specific clinical challenges. And ultimately, the role of Samyak Vasti Lakshanas, when to assess basically, is it after first Vasti, or if I'm planning a Yoga Vasti, is the Vasti after three? If it is it after all the three Vastis? How is the plan that we need to work on it? And practically, how ground level reality, how to assess these Vasti Lakshana. So these are our clinical challenges. So, in the context of Charakacharya, in the context of Vasti Sutriyam Siddhi in Siddhisthana, in the context of third chapter, okay, he says Sameksha, Dosha Aushada, Desha Kala, Satvya, Agni Sattvadi Vayobalani, Vastihi Prayuktaha, Niyatam Gunaya. So, Vasti has to be done with respect to understanding first dosham. Okay, and second one is the Aushada that we are using in the Vasti. Then Desha, Kala, Satmya, Agni, Sattvadi, Vayo, Balani. Agni, Sattva, Vayo and Balani. Vastihi Prayuktaha, Niyatam Gunaya Syat, Sarva Karmani Cha Siddhimantihi. So, these many variables are clinically present in the patient of dosha, Aushada, Desha, Kala, Satmya, etc. when we are planning when we are planning. So you have to be assessing sattva before you plan the total quantity, because alpasattva people, when they have sudden evacuation of large quantity of feces, liquid or whatever, there are possibilities of complications more than a pravara sattva patient. Satmyata, patients who are satmya to ghee, etc., for them small dose of matra vasti may not be a good possibility. If there is Agni Mandhyam, you should not be going for Matra Vasti or Sneha Vasti initially. Then there are possibilities of Vastis that actually cause Agni Deepana. So that has to be thought of. So these ways, so what is Samiksha Chakrapani says, Jnana Purvakam Aveksha. So this Jnana with respect to the patient must be there for the proper assessment of Vasti. So, the guiding one-liner with respect to the Vasti context could be Vastistu Adhonabhe. So, Vasti, whenever the Samprapti has clinical manifestations from Adhonabhi, whether it is knee joint, low backache, lower abdomen, burn, etc., etc., whether the Samprapti has got any Samprapti begins anything with relation to Pakvashaya, like you may have Shiroshula, but the cause behind would be the Purisha Vegarodham or Udavartajanya Samprati, if that is the case. So that has to be taken care of. So generally what we can do is Vastistu Adhona Behe. Astistu Adhona Behe. So whenever Vasti, this is one liner from Vadavyadi Chikitsa, which speaks about, whenever there is the clinical manifestations in the background of Adhona Bijavikara, Vasti is the possibility. So what we can think is, if the whole Samprapti starts in the Pakvashaya, like for example, Udavartajanya Manovikara, okay, definitely Vasti is a possibility. A bank employee who regularly sits in the office, stressed up and all, who has Purisha Vegarodham as a background, she will not respond to Patyaksha Datrayadi Kashayam. She will respond to Chirulyavadi Kashayam with Avipatti or Hingojadi, considering Koshta. In that case, the best treatment on admission would be Vasti in the initial phase itself. So that is the one-liner that help us to undertake that Vasti is the best possibility in these conditions. Once we decide that, basically, we have some guidelines. We do have some guidelines from other context when we can decide. Jwara. So ultimately, it is very important when we are assessing Samyak Lakshana, the placement of Vasti is correct in any Samprapti that we are discussing on. So the placement of Niruhasi, Jwarakshinasya, na hitam na vamanam na virechanam, kamam tu payasatasya, niruhai hiva haren malan. Niruhaha balam agnim cha vijwaratvam mudam rujim paripakveshu dosheshu prayuktaha shigram avahet. So in Jwarakshina also it is told hitam, vaman or virechna is not hitam. In that condition, like pious can be given. Similarly, Niruha can do Malar Nirharana, giving Agni Balatvam. So, but the target is what? Paripakveshu dosheshu. Dosha has to be paripakva. That is why, in patients of Guillain-Barré syndrome, they may have general weakness, loss of appetite also in the background. But then in such acute cases, on a 3 or 4 months background and all, we practice Kshiravasti in small doses initially 400 to 500 ml. We have done like 3 or 4 sittings of Shiravasti, etc. Okay. Now think about Anuvasana Vasti again. See, Valeri specifically context of Jwara. Jware Purane Samshine, Kabapitte Dridagne, Rukshabadha Purishaya, Pradidhyada Anuvasanam. Okay, so Anuvasanam has to be Prakshina Kabapittasya, Trigaprashta Katigrahe. Kafapitta has to be Prakshina. Trikaprishta Katigraha and Trikaprishta Graha can be there. Deeptagnehe Baddha Shakradaha Prayunjita Anuvasana. Agni Deepti must be there for giving Anuvasanam. And if there is constipation, Anuvasana is a needed thing, but you have to be taking care of the Agni of the patient. So, state of introducing Anuvasana is Kapha Pitta Prakshina. At the same time, Vata plus plus. So this has to be the status. Now see, even though the Vyadhyavastha is indicated for Vasti, but we have to see the fitness for the Vasti. Okay, because I'll just share 1 or 2 experiences that we had, after which we make it a point that we made it a must that we assess the patient for Vasti. For example, in there was a case. She was a female, yeah, elderly lady. She had come to the OPD. She was admitted on the same day. So she had not passed motion for 2 days. She complained to the consultant, and the consultant suggested Kshiravasti in that day only. And he asked that you do it by 12:30. She was admitted by 11:30, so that you can give food after afternoon lunch after Kshiravasti. This was told, and she was posted in the theater. Kshiram was prepared, and Shiravasti was done. And suddenly, when she was done and she went to the toilet and she collapsed, we had a call. I had a call. I was in the OPD theater. In the theater, there will be a medical officer and therapist, and one faculty will be in the OPD, the other in the IPD, and medical officer in the theater. So I had a call. I had rushed to the site, and I could see that she was collapsing. Eyes were going up, and suddenly we had actually lifted her, kept her legs up, and we had given CPR. Pulse was feeble and all. Then she revived Siddhamagaradvajam and all. Siddhamagaradvajam was immediately given, and she revived with that. Okay, but even though I was asking Amma, tell me where are you? She was slightly responding, but highs were going on. She was like completely off. Now then we revived it. Then we assessed what was the reason for that. Why this would have happened. So when at that time we had actually called her daughter who was outside. She was 75, daughter was I think 50, 55. She told me that Amma had fainted. Yeah, doctor, always whenever she passes motion or lose motions, no, she used to faint. Did that happen again? So this was a known thing in her case. Okay. Second thing, she had traveled from Thrissur. She had come down to Guruvayur temple in the morning. Then she had come to our hospital. So, from morning, she just had little food. She did not have anything. By 12:30, when Pitta is high, we had done a Shiravasti. Even though Shiravasti, but that was an evacuation that has caused imminent Rasakshaya that might have caused these things. Okay. So this Rasakshaya imminent, and we have to revive it. We have to give some that actually brings back the Sapnya. That is why Siddhamagaradvajam is considered to be Prana Sthapana. Usually Siddhamagaradvajam, Dhanvantaram, Bruhat Kasturi, Bhairavam are the things that we use at that point of time. So, fitness of the Vasti, After that, we actually at Ashtanga college where I work, all Vastis, Panchakarma people, we assess them for fitness. So whether it is indicated, whether any previous history, their cardiac evaluation, if they are diabetic cardiac issues, they are sent for ECG. We have a Vasti fitness chart assessing all these things. Is there any history of piles, any mass per rectum, etc.? Then if it is there, we'll be sending them to Shalyam for an examination. So this is the procedure that we generally follow in respect to fitness for Vasti. So that is why whenever we are planning for a Vasti to a patient, even though the condition may be indicated, but the patient's fitness at that point of time, we definitely have to be assessing. So when we are doing the procedure of Vasti, when we are assessing the Samyak Lakshanas, actually, the Samyak Lakshana or output of the whole Vasti depends upon all these things. How we are making Vasti Dravya, Herandamoola Kashayam, how much medicine is taken, how much is reduced, that concentration has to be there. Even though text does not speak how much to make the Kashayam for Vasti, Sharangadara only is the person who speaks about the content. Then how beautifully we are giving the mixture, mixing the Vasti to make it into an emulsion. Then how are we administering? And the post Vasti measures, kind of for Anuvasana Vasti and Niruha Vasti. After that, giving food, waiting. So all these things done in the proper way only will give a better outcome. Okay. So when a Vasti is mixed, we know na davatya aushadim panim, na tishtatya avalipyacha, na karoti na semandam, sa niruhaha suyojitaha. So that suyojita niruha, that medicine mixture is best only when na davatya aushadim panim. Pani does not have liquid that is flowing off, that the consistency should not be very loose or should not be very thick that it gets avalepanam. It sticks on. Na karoti na semantam. It does not make the layers. That is why na semantam. Semantam is like, partition. So the medicines, the contents of the vasti does not form in layer form. So that kind of combination is called as suyojita niruha vasti. So that vasti mixed has to be proper. Only then we will be getting the samyak niruha lakshana. And for Samyak Niruha Lakshana to happen, that means Niruha to be administered in the Samyak way, most important aspect is also the Matra has to be correct in terms of the patient's Bala and Samprapti. So for an adult Vasti, we all know it's Dwadasha Prasarta Vasti. Okay, the total quantity has to be 12 Prasarta or 24 Pala. If we say it as 50 ml as 1 Pala, 24 Pala would be almost 1200 ml. So the adult Vasti has to be somewhere between 1000 to Dwadasha Prasarta Vasti. Somewhere has to be 1000 to 1200 in between. Of course, in Charaka Samhita, in Prasarta Yogiyam Siddhi, Prasarta, Pancha Prasarda, Shat Prasarda, Nava Prasarda Yogas are told, wherein the quantity is not as high as a Niruha Vasti. Coming under the Yapana Vasti, Yapana Sarva Kalam Deya, that can be given at all point of time. So generally when we make a Vasti Dravya, in untold Vastis, Drava Dravya has to be 5 Prasarda. Like 500 ml Kashayam has to be there, Drava Dravya. Taila and Madhu has to be with respect to the Samprapti. If Vata is more, 1 by 4th Tailam, 1 by 8th Madhu. If Kapha is more, 1 by 4th Madhu and 1 by 8th Tailam. 1 by 4th of the total quantity. Okay. So, if Vata is more, Madhu Tailika Vasti are those combination that have Madhu and Taila in sama quantity. So that according to the dosha, we can change the dosage. Amount of Saindava is important. Saindava has to be generally 1 Karsha. And if the Saindava is less, evacuation may be compromised. Saindava is more, Adiyoga can happen. Quantity of Kalkam actually gives consistency and it regulates the mode of action also. So usually in a Madhutailika Vasti, we make Dvipichu. Dvipichu is 2 Karsha, 30 gram. But otherwise, up to 60 gram Kalka is taken. In Anuvasana Vasti Dravya, adding Churna and Saindhava to make it held, like to hold the Dravyam in a more way, it's a practice. So in 100 ml, we add 2 gram of Churna and 2 pinch of Saindhava and make it lukewarm and do the Anuvasana Vasti. So time of administration, I think every one of you know. Charaga says abhukte, but Ashtanga Hridaya says madhyane kinchid avrate na atti bubukshitam. So madhyana has to start, but the patient should not be having too much of appetite. That means, somewhere between 9:30 to 11. As now we are doing it at 9:30 at Ashtangam. Now it is summer. But in winter, we do it by 10:30, 11. So according to Kala, we change the time. Okay. So for proper Samyak Lakshana to happen, this Purva Karma is also relevant. Snigdha Svedanam. Abhyangam, generally it is observed that when the Purva Karma is done in a whole body fashion, like full body Abhyangam followed by a steam and Vasti, the evacuation is better. Otherwise, local Abhyangam and Ushma Svedam and Vasti is done. Whichever is practically and otherwise feasible. But to have a full body abhyangam, then have a steam chamber if the bala of the patient is good, and then make her undergo a vasti will give a better systemic action. So procedure you all know actually. Okay. So smear thylam, then we look for fecal impaction, insert slowly in a better way. And immediately after Vasti, the Vasti is given, patient is advised to lie down, and when she feels like she's asked to go to toilet, evacuate properly, and immediately after evacuation, he is asked to have hot water bath, come out with and have food with respect to Kshira, Yusha or Mamsarasa with respect to doshas. So if we have Pittanubandhato more, we give Palkani. Okay. If otherwise, it is Yusham. Okay. And of course, Odanam is also told. So practice to practice. So here we actually give Kanyi, Paya. Patients say, I don't want to have Kanyi at all, doctor, after Vasti. So we give Odanam only. In specific, generally our diet is Vasti diet is easily white rice with more kacheda, that is processed takram with some curry that is just has cucumber or something like very uh, cooked vegetables. We call it as molution. Okay, with no spice, no other hot things, just a little turmeric and little salt. So that will be the special Vasti diet actually. And then little rasam will also be there. So like supported as Yusha and Mamsarasa kind of things only. And if the patient is unable to have that rice, we go for Peya, but generally rice is given. Odanam has been told because it is actually why this food after Vasti is because of the evacuation through the rectum, too much of evacuation, there is Vatakopa in the Pakwasha, which is again Vatasthana. To reduce that Vatakopa and Vayu to come upwards, we give food immediately after Niruhasti. But at the same time, for Anuvasnavasti, the Dravyam has to retain basically, and hence Anuvasnavastis. Dravyam has to retain in the body because it has to get absorbed and spread its action as mentioned. So it is done after food basically. So that is the difference of giving Niruhavasti, which is intended to bring out unwanted things and things come out. Anuvasnavasti to stay and get the thylam, snigdhada to the body. So after food and before having food, this is the basic difference. Okay. Now, when we think about the clinical scenario, when a simple IP setup, a clinic of 5 to 10 patients are there, our variables would be which one, when to be done, how much, and practically how to assess. So, we had actually, for Samyak Lakshanas, we had actually observed almost 75 Vastis presenting how did they present with respect to different thing, and was there any relation between Koshtam of the patient and Samyak Lakshanas, Koshtam of the patient and Prakriti, and Koshtam of the patient and other Samprapti and Samyak Lakshana. These things were actually observed. And is there any relation between retention time and a Samyak Lakshana? Because many places I've seen, doctors telling, you if the patient wants to evacuate, doctors tell don't evacuate, you hold for some more time only, then you evacuate. So is that the right practice? And is there a direct relation whether this time taken for retention and evacuation and Samyak Lakshana are directly related. So these things are basically observed with 75 cases at our own hospital. So I'll just share the observations before we discuss the Samyak Lakshanas. So many places, especially in here in Kerala, some traditional hospitals practice 8 a.m. Vasti without food. Generally in academy, it's 9 to 11:30 a.m. with prior little food. According to season, like as I told, no, summer 9 to 9:30 we go for that. Or in winter, it is somewhere between 10:30, 11. Okay, so Samyak Niruha Lakshanas are indications of optimum action for the physician to understand. See, when we are assessing Samyak Niruha Lakshana as a patient, it is for the physician to assess ki, yes, the problem. It may not say all the Lakshanas or all the changes that might have happened in the patient. No. It is saying that giving us some guideline that yes, the procedure has acted in the right way. So it will bring in whatever changes the body has to bring in the case basically. So that is why we had discussed in the last session wherein Acharya has not mentioned disease wise Samyak Lakshana, it has been told common. Samprapti wise there will be definitely different changes in the body. Okay. So see, to assess Samyak Niruha Lakshana, first Charaka says, Prasrishta Vinmutra Sameranatvam, Ruchi Agnivriddhi Ashaya Laghavani, Roga Upashantihi Prakriti Balam cha Tatsyat Sunirudha Lingam. Okay, so Prasrishta Vinmutra Samiranatvam. So Prasrishta Vitta Mutra and Samirana. So the order there has to be first there will be Vitta Mutra and Samirana. After that Ruchi Agni Vriddhi Ashaya Laghavam. Ashaya Laghavam is one Lakshana. Ruchi, taste will be there. Agni Vriddhi will be there. Roga Ubhagashandihi Prakritihi Tadacha. Balam cha Tadasyad. So Suniruda Lingam, actually it is not, it does not mean that immediately after first Vasti we will be getting all these Lakshanas. No. That is why as I mentioned, generally we have to classify these Samyak Lakshanas into immediately observed Vastis and those Vastis that we observe, those Lakshanas that we observe within a day or two and over a period it is Roga Upashanti. Roga Upashanti may not happen after first Vasti. Okay. So, so immediate see what the patient has evacuated. That is our first thing. Second one is how the patient will feel. Ashaya Laghavatvam. Agni Vriddhi Ruchi he will have in the evening next day. Over a period like Yoga Vasti, if you are planning or Kala Vasti, 5 Vastis, over a period we discuss Roga Upashantihi and he has to come back to the Prakriti Sthata. Okay, so that is the order that we can follow. So see here Acharya Chakrapani says Ashe Lagavani Ityartha Ame Lagava somebody says Tena Roga Upashantihi Iha Niruha Sadhya Vikaranam Upashantihi. So Roga Upashanti means whoever so that means whoever for whatever purpose we are giving the niruha, that whether it is coming down. So here ashe lagavan mitretre it need not be ame lagavam because already roga upashanti has been told. That is why like that there is a discussion. So anyway, so that ashe laghavatvam it is not ame laghavatvam. Chakrapani substantiates that only. Ashaya means what ashaya? Any ashaya you can feel. You can see it as Pakvashaya, Amashaya, Koshtam, Garbhashaya, whatever. So he generally speaks about Amashaya. So now, clinically when we assess, many times immediately after Vasti we grade it. Patients say, you feel like lightness of the tummy. Yes. The next, I ask, do you feel lightness of Uras? Uro Laghavam. Yes, patients, they come and tell me, doctor, after so long, I feel so light in my head. Everything has gone now. My head has become light. So that is ultimate thing. So I clinically assess 3 things. After Vasti, did you evacuate and do you feel light? Yes, doctor. Where do you feel light? It's in the stomach. Yes, grade 1. So now do you feel lightness in the chest? So Ashay Lagava means I Ashayam of Amashayam Pakvashayam, then Uras, then Shiras. Okay. So when the best evacuation might have happened, after first Vasti only patient will be asking, telling about Shiro Laghavam. Okay. After a first Vasti, he had only Amashay Laghavam. That means next Vasti you can increase the dosage of the Vasti. so that better evacuation happens. After first vasti, if the patient says, Doctor, I feel heavy, no laghutom at all. That means we must understand our vastis has not worked at all in that way. Okay, so that is one. And over a period, on the day or next day, patient must have improved appetite and improved agni. If any of the patient says, I don't feel like eating or I feel my hunger has come down, that means we must assess ki my vasti is not done in the right way. Okay, so that is important. Now in Ashtanga Hridaya, it has been specifically told, Swayameva Nivartetu, Swayameva Nivartetu, Ditiye Vastirishyade, Tridiyo Api Chadurtopi, Yavadva Sunirudata. So that is the specific thing. So see, very specifically it has been told, one second. So, Swayameva Nivartetu Tvitiyo Vastirishyate. Tritiyo api chaturtopi yavadva sunirudhata. Viriktavadacha yogadin vidhadyad yogetu bhojayet. It has been told. See, Ashtanga Hridaya says, if the Vasti Dravya comes out by itself, and with no other evacuative signs. Okay, Vasti just comes out. It Vasti Dravya, you give Vasti Dravya and the patient evacuates only Vasti Dravya with no other content. That means Acharya says you have to go for second Putaka of Vasti. And you, if still medicine only comes out, no other mucus, anything coming out, then Tritiyo api, Chaturto api, till Nirudhata, Sunirudhata, Yavadva Sunirudhata, Swayameva Nivrittetu, Dvitiye Vastirishyate, Tritiyo api Chaturto api, Yavadva Sunirudhata, it has been told. Viriktavadacha Yogadin, you assess the Virejana Lakshana as, Niruha Lakshana as, Viriktavat only. What is Viriktavat? Kabhandam. Virechana is Kabhandam. Vamana is Pittandam. So Kapha has to be the end point. Yogadin Vidadyad Yogetu Bhojayet. Only after Samyak Yoga is attained, he must be given Bhojanam, it has been told. Okay. So in Ashtanga Hridaya gives us an idea about second or third Putaka or fourth Putaka till Samyak Lakshana. Wait for that and then give food according to the situation. So that has been told very specifically. Okay, so there are studies wherein single Putaka study in a case single Putaka Madhu Dailaga, and in same case first Putaka, then patient going to toilet, if no much evacuation, no Kafandam in after, then immediately the second Putaka second is given, then observed for these things. So this has been told. So that is why till, so specifically it has been told that till Samyak Lakshana, it has to be done. We have to be doing the second or third Pudaka. So observing Samyak Snigdha Lakshana is very important. Now Susruta Samyak Lakshana, when we go through it, Yasya Kramena Gachanti Vit Pitta Kafavayavaha. So when we think of Vamana, what is Vamana? There we have Kramat Kapha Pitta Anilaha. Okay, Kapha, then Pitta. Anila is always last. Okay, here Vitta Pitta Kapha Vayavaha Laghavam jo upajayate sunirudham tamadished. So Kramena Vit must be there. So patients say actually, doctor, first loose motion was there, then some yellowish fluid comes out, and then mucus kind of thing. What we ask the patient is, you observe what have you passed, is the content very slimy, so that has to be there. So that evacuation system, what the patient has evacuated, we have to assess with respect to Vit Pitta Kapha Vayavaha. Laghavam cha upajayata sunirudham tamadishet. The patient must have laghavam. So laghutvam is one lakshana that has been mentioned by almost all acharyas. Okay, so Laguttam is one single. If we want to assess our Niruha with one single Lakshana after Vasti means that is Laghavam only. If the patient does not feel Laguttam after a Niruha Vasti, it indicates our Vasti is grossly not done what we are expecting it to do. Okay, and Susruta also says Viviktada, that means clarity, Manaha Tushtihi, Snigdhata, Vyadi Nigraha. आस्थापन स्नेहवस्त्योः सम्यक् दाने तु लक्षणम् and आस्थापन स्नेहवस्ति सम्यक् दाना proper administration has to give. So manatushti snigdhata vyadi nigrahatvam must happen. Okay. Now, definitely in Ayoga of Vasti, we will be having Kabha Lakshanas like Shiroruk, Hridgudavasti, Shofam, Pratishyayam, etc. Shiroruk is one common thing that we generally observe. Adiyogam is not very commonly done, but then we have to understand this Adiyoga of Virechana, wherein Nidra, Bala, Abhavaha, Tama Praveshaha, Sa Unmada Hikkaste Virechite Ati, Sa Unmada Hikka. Here the Unmada is actually representing hyponatremia. Okay, so electrolyte imbalance has been told. That is why Unmada, this we all know, no? Hyponatremia present with generalized this unlinked talks and etc. Hikka and all coming up. So, Kafasra Pitta Kshayajaha Anilotaha Supti Angamarda Klama Vepanadeyaha. So generally if there is Vepana, after Vasti going to toilet, the patient shivers, immediately we give sugar to the patient. Okay, and then we give Siddhamagaradvajam. If the patient again has sudden loss of consciousness, we tilt, keep the leg upwards, do sway them and smardana to both hands, and then if pulse is volume and rate of pulses, rate is good and tachycardia may be there, but if the volume is good, we need not worry. It's just a vasovagal shock. But if the volume is less, when we are actually doing, seeing the pulse when we are doing Nadi Pariksha, if the volume is less, it indicates severe Rasakshaya. We have to be careful. So as I mentioned, when we are planning for Vasti, Niruha Vasti assessment, what the patient has passed, first we have to observe only Mala or Pitta, yellowish fluid or Kabhanta. Laguttam, feeling of Laguttam is there or not. Next day, so that is immediately to be immediately assessed Lakshana. Next day assessed Lakshana is Agni Vriddhi, Ruchi and all. And after 2 or 3 vastis, over a period, Vyadhi Mardavatvam Rogopashanti has to be assessed. So these could be the things that we can discuss on the outset. Now from Niruha Vasti, when we are moving to Anuvasana Vasti or Matra Vasti, that is commonly practiced by many, Pratyet Asaktam Sashakritcha Tailam. Asaktam means continuous without any obstruction. Sashakritcha Tailam, that is very important. When we are doing Anuvasana or either Matravasti, the patient says, Doctor, I passed motion and it's just only Tailam and there is no motion in it. That means you have to go for next Vasti immediately because Sashakritcha Tailam it has been told. Tailam has to go along with the motion. If there is no Shakrit in Taila when we are doing Anuvasana even for Matravasti, we can see that. That means our dosage is not rect. Raktadi Buddhindre Samprasadaha. Over a period, Raktadi Buddhi Indre Samprasada will happen. Sopna Anuvritti, Laghuttam, Balamcha, Srishtascha Vegaha. Okay, Srishta Vega. Vegam, like 2 or 3 times the patient should pass motion. Vega must be there. Okay. Swapna Anuvritti. Good sleep must be there. Laghutvam Balam. So these things must happen. Swapna Anuvritti is Nidra Anuvritti. Okay. So this is very specific. So after Anuvasana Vasti, first thing we have to assess is the patient says, Doctor, after half an hour I went to toilet. What did you pace? Only oil came out, doctor, nothing else. That means our dosage is not right. Immediately we have to go for next dosage. If patient says, then I slept, lie down for half more hour, then again motion and oil came out little, then it is okay. So 2 or 3 Vegas. So that is Srishtasta Vega. But by evening only oil came out, no motion. That means our Anuvasana dosage was not right. So this specific thing with respect to Anuvasana we must always have an idea. That is why in context of Anuvasana Ashtanga Hridaya says, Samyak hina atiyogasta tasya soho sneha pitavad. It is like sneha vasti, I mean snehapana only. Samyak hina atiyoga of like vatanulomyam, dipto agni, snigdha varchas, asamhata varchas, etc. has to be assessed. But at the same time, किंचित कालं स्थितः यश्च स पुरुषो निवर्ततः सा अनुलोमा अनिलः स्नेहः तत् सिद्धम् अनुवासनम्. Where the oil has to retain in the body किंचित कालः, then it has to come out sa purishaha nivartate. With the purisha only it has to come out. So single point that we have to think when we are doing vasti, I mean anuvasana vasti, is the patient has to pass oil along with motion. Shakrit has to come out. Shakrit, that we have to specifically assess. Okay. Ashtas from Susruta also about Anuvasana sa anilaha sa purishaha snehaha pratyeti yasya hutu osha josha vina. There is no osha josha. Shigram sa samyak anuvasitaha. Okay. Then Vishtabda anilavin mutraha sneha hine. There will be Vishtabda. If ati anuvasana daha klama pravaharti. That will be there. But I think those things except Agni Mandhyam, there will be some abdominal distension that I have seen when we do anuvasana without properly assessing Agni and all, but otherwise it is okay. Yeah, yoga and atiyoga of anuvasana. This adha sharirodara bahu prashta parsha ruksha khara chagatram graha will be there. Trilasa moha etc. will be there, but not very commonly seen. A few complications that we have faced clinically, but with all these spectrum is, as I mentioned, no, there was a multiple sclerosis patient. I remember, it was actually he was done vasti ruksha vasti kalyanagam kashayam with vilvadi guliga was done. After we had done it was our senior sir's case, so he had suggested that. So I was discussing, no, we have to add Saindavam. Sir told, no, we will see how he is responding. So with Kalyanakam Kashayam and Vilvadi Guliga, the medicine got retained and he did not pass motion at all. Okay, after 2.5 hours, even though it was Niruha Vasti, of course, only 350 ml. Then we had given Gandharvastadi Kashayam as Vasti. Then with the Saindhava, nothing else. But then even then nothing came out. He was like multiple sclerosis with weakness of bilateral lower limb. So it was very difficult for him to get into closet, from there getting up and sitting in the chair. So that was again. And then after then still the patient was not passing motion. So we had given it by 10:30. Well, 12, we had given Gandharvasthadi, no response. After half an hour, then we had given Nirgundi Erandam with the Gandharvasthadi. Okay, Gandharvasthadi Kashayam again taken, added some Nirgundi, 50 ml Erandadailam, then given Vasti. Still nothing happened. Then the patient was, therapist, almost 2 therapists were engaged for 3 hours. It was not practically feasible in the theatre setup. Then the patient was sent to room and observe. We will see how the patient will respond and observe. That we say. And nothing happened in that patient. Next day, he just went to the toilet, wherein, 1 or 2 Vegas with only Kashaya came out. So that was one Vasti which did not have Saindhava in it actually first. So after that, after we had a discussion, always whatever the thing, Chakrapani seeks about a Churnavasti, but in that definitely, only when, there is Saindhava, there will be evacuation. No other content, because 300, 400 ml, if we push through our rectum, what will happen? It will go and stay there. Okay, especially in a paraplegia case, wherein, there is no movement, he's stuck, his bowel, everything being already constipated, such things won't be working. So that was one clear observation, wherein, as I mentioned, to have Samyak, observe Samyak Niruha Lakshana in the patient, it is very important that we actually see to it that the combination of Vasti is correct. The dosage of the Vasti is also correct with respect to the patient. Okay. Yeah, this was another case wherein, she was a nurse. She was having constipation for long and she was on Dulcolax when she was approached. She was, and her pressing complaint was severe low backache. Okay. So she was given Vaidarnavasti on the first day. After Vaidarnavasti, the patient did not go to toilet. So the senior consultant, it was again done by another senior guy. His sir called me and told, Doctor, she has not passed motion. Can you go and observe what's happening? So I'd just gone. So I could see that she was having severe Krurogoshta. She's already on Dalcolax for last 6 months. With Dalcolax only she passes motion. And she was given Vaidar Namaste, which was very Ruksha in nature. And then you know what did we do after 1 hour? No passing motion. But patient did not have any other negative symptoms like any abdominal pain or palpitation, nothing. Okay. Then we had given again Gandharva Sthadi with Gandharva Erandadailam, 300 ml. Even after that, patient did not go to toilet. She was not having any urge at all. Okay. So, always in almost all hospitals, we have European closet, but Acharya says, Utkutena Srijet. You have to sit in Utkutasana for Visarjanam, he says. Utkatasana is our Indian closet posture. Okay, squatting posture. Then ultimately I felt, she says, Ki doctor, I have some heaviness, but nothing is coming out. I don't feel like going to toilet at all. She goes and sit in Europe and nothing happened. So I asked her to go and so there was another room with the Indian toilet. I asked to open the toilet and I asked her to go and sit there in a squatting position. And once she went and sat in the squatting position, very good evacuation happened. Of course, we had given Gandharva Stadi Kashayam with Gandharva Eranda Thailam after Vaitarnasti. So what was because of her chronic constipation, there was, and she also was having a previous history of fissure and all previously on and off. So I think the reason that we found out was definitely she was Krura Goshta directly without administering 2 or 3 matravasti, directly giving Vaitarnavasti with the Dhanyamalam Chincha, etc., which is more Tikshna Dravya, was not right in her Krura Goshta. So that could have been the correct thing. That is why, and with the air and the Thailam, she responded. But of course, she has to sit in that position because there was some structural defect also. So when there is generally pile mass, fissure, structural defect, and with some obstruction, this motion will not pass unless and until you sit in a squatting position. Squatting position is actually scientifically most ideal position wherein you can give the pressure to the low and pressure to the lower abdomen happens and proper evacuation happens. I think there is a study which says people who go in Indian closets have less incidence of fistula and fissure than using European thing because European closets are meant for those people who do not have too much of carbohydrate and bulky fibrous content like we. In India, we have rich vegetation. We are very rich in with respect to our diet, and we have fibrous content in our food, and also our motion, our feces will be bulky when compared to European. So Indian closet only is ideally suitable for us. So that is why Acharya also speaks about Visarjanam through Utkutasana. Yeah, so now from this, when we move on to the different yogas that we practice and practice, a few yogas I have just added here. So Samyak Lakshana basically depends upon also, what way. Samyak Lakshana for Kshiravasti, Samyak Lakshana for Vaidarnavasti, Samyak Lakshana for Madhutailikavasti may not be always the same. These Lakshanas have to be assessed, but there will be something additional that we need to observe. So, for example, when we are speaking about Vaitarnavasti, wherein we have Palashukti Karsha Gudaba Amlika Guda Sindhu Janma Gomutrehi, which is specifically done Shula Anaha Amavatahara, and it can be done Vaidarna Ksharavasti even after food we can give it can be given. Recently, I had a female patient who was having severe low backache. She was brought in ambulance in a way that she was unable to get her. She had come by 12:30. So I immediately asked, let her have some food and we'll go for Vaidarnavasti. And after Vaidarnavasti, 5 Vega she had in the afternoon. Her pain improved. But what happened by the evening? It was hot. By the evening, she attained periods also. She was telling her periods was only 10 days due. But with this Sushna Dikshna Vaidarnavasti, her low backache to an extent was better. That heaviness went off, but she attained periods also. So I could understand that we had done Vaitarnavasti, which is Ushna in Ushna Kala, but had periods almost 10 days due had come earlier. That means she has Pitta Rakta Dushti in the body. So her medications, internal medication should not be very Vata Kaphara like Rasna Saptagam, Dashmula Gadutrayam, etc. for her low backache. It must also have Pittahara Dravyas like Manjishtadi, Shadavari Chinnaruhadi. This was the understanding that we got by the body's response after 5 Vegas of Vaidyanavasti, Laghutam, reduction in pain and stiffness. By night, she attained periods. Okay, so it was after Vaidyanavasti. Okay, that is Vaidyanavasti's reference from Vangasena. Extrapolating that Surabhi Payasaha, there is practice wherein instead of Dhanyamla, milk is added as the Dravadravim in Vaidyanavasti. And when we speak about Vaidyanavasti's broad application, Vangasena say, Kati Uru Prishta Shofam, Shulam Cha Amanilam Ghoram, Chirabhava Muru Stambam, Grudrasi Rogam, Janu Sankocham, Vishamajvarani Ghoram Klaibyam Cha Vinashitaya. See, Vishamajvara has also been indicated in Vaidyanavasti. So, where in Jvara Vaidyanavasti has an application. So generally, as I mentioned, and where is it the status of Grudrasi where we go Vaidyanavasti and state of Jvara where we do Vaidyanavasti. That is Samprapti specificity. Okay, in a Grudrasi case, acute low backache with heaviness, we go for Vaidyanam immediately. But at the same time, a patient who has got some kind of long-term infective pathology in the body, having this some kind of autoimmunity, swelling on and off here and there. So it is Vishamajvaram, she has that autoimmune response for last 5 to 10 years. During the evening, she feels cold, etc. In that Samprapti also, Vaidyanavasti has a response. Vaidyanavasti has a role because that Pakwashi always has got an avaranam of Kapha Pitta in the background. Okay, so that is why Vaidyanavasti's broad application has been done. Now think about from Vaidyanavasti to Ksharavasti. सैन्धवाक्षं समादाय अम्लिकाय फलद्वयं गुडस्य द्वे फले गोमूत्रस्य फलानि अष्टौ गोमूत्र is अष्टफलं द्वे फल गुडा अम्लिकाय फलद्वयं from Vaidyanavasti to Ksharavasti the ratio of guda and amlika are only changing. We go for Ksharavasti in those cases severe rheumatoid arthritis initial stage not responding to internal medications therapy etc. There Ksharavasti will be the best possibility that we can do. Of course, in Ushnakalam, we don't go for that much. Okay. Now think about Madhu Tailika Vasti with Madhu Tailam Chadaprasardam, Shatapushpam Ardhabalam, Saindavardaksham, Deepana Brahmana Balavarnakara, Krimikushta Udavarta Gulma Arsha Bradna Pliha Mehahara. See, generally Meha is contraindicated for Niruhavasti. Generally, Arshas is contraindicated. If you go through the contraindication, Anasthapya tu Atisnigda, Kshatrarusko Brisham Krushaha, Amati Sari Vamiman, Samshuddho Dattanavanaha. Then Shwasa Kasa Prasekarsha. So Shwasa Kasa Prasekarsha is basically contraindicated for Astavanavasti, Ashtanga reference. But Madhudailavasti is indicated in Arshas. Kushti cha Madhmehi cha Masan Sapta cha Garbhini has been told. Contraindication of Astavanavasti. But Madhudailavasti is indicated in Meha. So even though there are ample, conditions of direct contraindication, there will be situations wherein specific indications, specific conditions wherein the Vasti has to be done, then you have to go for Madhudailaga Vasti. So in Madhumeha, a patient has got low backache with, a 60+ year old male patient with low backache, he's diabetic, he is still Prabhuda Mutratva is persisting and all. In such case, definitely the Vasti would be not Vaidyanavasti ideal, but the Vasti would be Madhudailaga Vasti. Only when we do Madhudailaga Vasti, he'll be getting the Samyak Niruha Lakshana in the context. Okay. Yeah, so in that way, what I wanted to tell you with respect to Vasti is before moving on to Nasyam. In Anuvasnavasti and Niruhavasti, Anuvasnavasti sa Shakritsa Tailam has to be always taken care of as Samyak Lakshana. In Niruhavasti, how the Vasti is mixed, how much the Vasti is given, how we are giving it, and the Samprapti of the patient, along with what Vasti, Madhudailaga Vaidarna Kshara, what Vasti we are giving, is responsible for the overall outcome as Samyak Lakshanas. There, as I mentioned, Laghutam is one single point and the order of evacuation from Vitta, Pitta and Kapha. That has to be the order of evacuation. In the first vasti, if you observe Vitta and Pitta, next vasti the patient may present with Vitta, Pitta and Kapha. So these difference you will always have to be observing. Yeah. Now from moving from vasti towards Nasyam. As you all know, Nasyam is of course gateway to the Indriyas. That is why after Koshta Shodhanam, Nasyam has to be done. Okay. So generally when we practice Nasyam, of course if there are Urdhvajatra Vikaras directly, we can directly go for that. But we observe, if you observe this Urdhvajatra Vikara as a part of the whole system manifestation, then definitely after Koshta Shodhana, if we admit the patient after a Virechana or Vasti only, what do you call it as after Virechana and Vasti only, Nasya can be done. Okay, that is why. So when we are doing Nasya to a patient, again for the response, Samyak Lakshana as a whole topic, I mean for the whole process, Uttanasya Shayanasya Shayane Swastrade Sukham Pralamba Shirasaha. The position, how we are doing, the Purva Karma, Pradhana Karma, all these things are relevant. Only when we do all these things in the proper way, Samyak Lakshana will happen. Okay, that is why Snigdha Svinno Uttamangasya Prakrita Avashagasya cha Nivata Shayanastasya. Like after, before Nasya, Uttamanga Svedana must be there. And then he has to be lying down on the droni with legs up down and Shiras in a lower position. So that position is very important. In Nasyam, how we are doing the whole process before procedure, that is important. So how to do, see the Svedana that we do before Nasyam in the face, neck after putting talam. So generally face, neck, the upper shoulder, etc. we do Nasyam. I mean we do Abhyangam with the prescribed oil. Shoulders, Skanda, that area has to be taken care of. That Abhyangam has to be done. Face has to be done. Face, neck and shoulder has to be covered for Abhyangam. Then we go for Talam has to be kept, and then after the Abhyangam, you can put the Talam and do Abhyangam or Abhyangam and Talam. Of course, before Svedana, Talam has to be there. You have to tie the eyes and then Svedana has to be done. Okay, Svedana should be done in a way that Samyak Svinna Lakshana happens. Usually in Nasyam, Samyak Svinna Lakshana we observe Lakshana in the nose, tip of the nose, neck, etc. Okay, so there are some I mean, practices wherein if you are planning for Apabahukam, Nasim in Apabahukam, we do a Jambiravinda Svedam or Patra Potla Svedam local in the neck and shoulder, and then we do it, and then we observe, I mean, do that, then do Ushma Sveda and do Nasya. Otherwise, simple Abhyangam for 5 to 10 minutes, followed by Ushma Sveda and Nasya is done. Okay, so you do Nadi Svedam in the front and back. The position Pranitapa Parisvinnam Rudita Galakapola Lalata Pradeshaya. So all this Pani, then Gala, Kapola, Lalata Pradeshaya. All these things has to be done Snehasveda. Then Prasarita Karacharanaya. You have to spread your both hands and legs to lie down in a supine position. Shaine. Vishmana Shaine. Okay. So when it has to be done, Prak Surya Madhya Surya Prakrita Avashagasya. So generally Pratah Shleshmani Madhyana Pitte Sayam Nishostale. So morning Shleshma, evening for Vada. Yeah, the posture. Okay. Kinchit pralambita shirase vastravacheddha netraya vamahassa pradeshinyagra unnata nasagraya vishuddha shrodasi dakshana hastena. So the physician must hold the medicine with dakshana hasta and raise the tip with the vama hasta and then pour the nasya dravya in each nostril. So after pouring and the patient starts evacuating, now you have to observe how the patient responds to it. So many time we observe what he is spitting out. Actually, spitting out is never told as a Lakshana in Samyak Lakshana. Okay. In the process, you know, there will be kabam coming out and you spit out on sides, it has been told. Uchingya, it has been told. Like you say, you just spit the medicine out. Medicine and the content out. But in Samyak Lakshana, that has never been told as such. See, so if we are planning a Brahmana Nasya, Samyak Snigdhe, Sukha Uchvasa Swapna Prabodhagatvam. That is very most important. Sukhochhasa, Sukha Swapna Prabodhaga, and Akshapadavam. So, Sukha Swapna Prabodhaga means easily feeling to sleep and then easily getting up, you know, not feeling like I want to sleep for some more time like that. It is not there. And Sukha Akshapadhavam, all your Indriyas are very smart generally. So, that is the thing specifically told for Samyak Snigdha Lakshana, it has been told. Okay. Okay. In Virechana Nasya, that is for Samyak Snigdha Lakshana in Brahmana Nasya. In Virechana Nasya, Uro Shiro Laghavam Indriya Shamam Sroto Vishuddhascha Bhaved Vishuddhehe, it has been told. See, so Uro Shiro Laghavam Indriyat Shamam, it has been told. Shiro Laghavam and Uro Laghavam along with the Indriyat Shamam Sroto Vishuddhihi, all Srotas is getting cleared off. So, whatever there is obstruction of Srotas, so whether it is your nasal blockage or ear, your smell, taste, whatever the issues are there, that Srotas has to be cleared out. And Uro Laghavam and Shiro Laghavam. So, after Nasyam also, it is not just for Shiras, it has got its own response in the Uro Laghavam also. So, it has to be the response of Virechana Nasya. Okay. So, if it is Brahmana, he must have Sukha Uchvasa and his sleep and waking up schedule has to be will become proper. It is only for Virechana Nasya that if we are actually planning for a Shodhana like Swarasanasya or Marshanasya with Shadbindu Daila kind of Virechana Nasya, we must be observing Laghutvam after Nasyam. That is very important. If Laghutvam is not there, our Virechana Nasya will not be successful with respect to its response. Okay. Of course, for Ati Yogam, it is not very commonly seen. Snigdhe Adikando Gurutvam will be there. And as I mentioned, if it is Ati Yogam again for Rechana Nasya, Mastulungagamam, Vada, what is called Durvirikte Gadodreke Kshamata. Gadodreke means disease will aggravate, Kshamata, generalized debility will be there, and Ati Virechana can, because of that, it can happen. So, you know, naturally, what you call it as practically, when we do any nasya, the patient should not be having any headache, burning sensation, redness of eyes. After Brahmanas nasya, he should not have this feeling of cold and fever, which may happen because of, you know, as I mentioned, ayogam. I have seen cases wherein, you know, after Kshiravalla nasya, 2 to 3 nasal blockage. He was given Shirabala some months back by a physician. Then he felt this cold nasyam. They had done Shirabala, well, a cold kind of thing. They had done Shirabala. Next day she landed up in fever. So that should not be the case. Okay. So maculopapular eruptions, face eruptions can happen. So all these things indicates there is ayogam of the nasyam. Very rarely atiyogam. Okay. And you know, like Pratimarsha, when he says, we usually say Bindu Pramana in nose and all, but you know, Nastaha Sneha Angulim Dadyat Pratihi Nishicha Sarvadaha. You know, you just dip your fingers in oil and then just have a kind of, then that becomes Pratimarsha. Charaka says, Nacha Uchinge Roganam Pratimarshaha Sadardekrit. You need not, like, you know, inhale it and spit it out. Na chinge daroganam pradimarshahasa. So you need not do it that. You just have to take a sneha angulim nastaha dadyat. That is enough. Prataha nishihi cha sarvada. Apply oil and just apply it in the nose by just what you call it as inhaling it inside. That would be enough. स्नेहनं शोधनं चैव द्विविधं नावनं मतं प्रतिमर्शस्तु नश्यार्थं करोति न च दोषवान्. Okay, if Tikshna Dravya is used, Sneha Dravya, Sneha Nasya should be followed by it. If done for Sambhana purpose, Svedana should not be done. That is why for Pitta Anubandha condition and all, Svedana should not be done. Just direct Sambhana should be done. Only for Vada Kapha, Sneha Sveda has to be done. So as I mentioned, for Abhyanga and Sveda depends upon dosha avastha and purpose of Nasya. In Pravarta or Drava dosha, without or with minimum Sveda, but in Apravarta dosha, like if after I have seen wherein after Pakshagada, this aphasia, dysarthria kind of condition, we go for Nasya, but the evacuation is not proper. Then again we go for Svedana after Nasya. Okay, like he might have spitted out, but nothing is coming out. Then we go for Svedana again. Then again things will, there will be much better evacuation. So if dosha is apravarta, then Abhyanga Ushma Sveda can be done again after Nasya. This reference is there in Sangraha, which we practice practically. And if many a times patients, especially when we do Nasim in Parkinson's case and all, they inhale the medicine but nothing comes out. Okay, after 2 or 3 days, patients present with loss of appetite because their patient medicine might have gone through the esophagus to the stomach. They will present with Agni Mandhyam. Okay, so throughout the course of Nasyam, the status of Agni and Koshtam also has to be monitored throughout the course and it has to be observed, which is very important. Now from Nasyam, when we go through the Murdha Taila, the different procedures that we apply in the head, Abhyanga Sega Piju Vasti. Abhyangam is for Vatakafa, Sekam, Arumshika Shirastoda Dahapaga Vraneshu. So it is more of Pitta Kabhanu Bandhatvam. And Piju is for Kesha Shada Spudanam, Vada Pittam. Vasti is for Vata plus condition. So when we are applying oil on the head or different prayoga, this dosha specificity we must always have. So when we are thinking about, see all these procedures, Abhyangam wherein there is more pressure, uh, superficial exciting, but in Vasti there is, pressure is much high because a specific quantity of oil is made to retain over the head. But in Sekam, there is continuous draining, the current is continuously moving, but there is no what do you call it as specific what do you call it as retaining, and the pressure is not there as like in Vasti. So we could see all these 4 techniques are different techniques to stimulate the body's responses actually. So when we are planning, the Shiro procedures, for example, Takradhara, Kshiradhara and Taila Shirodhara. These are the Shiro procedures. Takram, which is Shita Ruksham, it is Kaphavataharam. Kshiram, which is Shita and Snigdha and Madhura, it is Pitta Vataharam. Thailam, which is Ushna and Snigdha, is Vata Kaphaharam. So, if the patient presents with headache, after a Koshta Shodhana, if we want to plan a Shirodhara, if the patient where to go for Takradhara, Kshiradhara and Tailadhara, this clarity we must have. If the patient is having Ushna Snigdhatvam, we need to induce Vadakaphanubandhatvam is there in the Sambrapti, Taila is good. If the patient is having more of Pittanubandhatvam, Kshira is there. If the patient is Kapha, more heaviness, depression, all those things, then Takra is the best option. So these specific observations like selection of head procedures we need to work on. So here, Samyak Lakshana with respect to Murdha Daila, of course, Shirovasti, we have only in Shirovasti, Acharya speaks about, the Samyak Lakshana of Nasa, Asya, Srava. No other Shiro procedure, Acharya speaks about a Samyak Lakshana, when to stop or when to stay. All this Shiro Taila procedure, similar to Samyak Snigdha Lakshana only, Vadanilome, Magrinditi should always be there. If we are planning a Takra kind of Ruksha procedure, Takradhara, then Samyak Langhana Lakshanas like Vimalendriyata, Sargomalana, Laghavam Ruchihi, Kshuttatritta Utsahaha, that Samyak Rukshana Lakshana has to be found out. Throughout the procedure, we saw for Shiro Tailadhara, Shiropiju, Shirovasti, Shirovasti Nasasisravam, which indicates Utkleshna of the Kabha, but other thing all Samyak Lakshanas of Samyak Snigdha Lakshana only. For Ruksha procedure like Talapodichil and this thing, definitely Samyak Langhana Lakshanas have to be observed. But throughout the procedure, we must ensure that Agni is normal and Vatanulomanam is maintained throughout the process. That is why the indication of Talapodichil from Shirasedagadi Vidhi, it has been told, Klamam Apachi Shirodaha, Rojonmada Pramehinam, Kafipittamayarthanam, Itareshamsta Prashasyate. See, for Hall Shiraseka, Klamam Apachi Shirodaha, Rukku Unmada Pramehinam, and all Kafapittamayarthanam. In all Kafapitta Amayartha, you can do that, and you must observe what it's the Samyak Lakshana, the Kapha Amaya or Pitta Amaya that the patient has, that how signs and symptoms are reducing over a period. That is the thing that is being observed. Okay. So I think towards the end, what I would like to discuss or communicate is, actually when we speak about Ayurveda and the different procedures, ultimately when we are doing the different procedures, we are actually stimulating the body's intelligence to respond in a proper way. For example, so see, we have dhara that we do in the head. We take every day head bath. Every day we head bath refreshes us. If we do go, if it is raining and we just go outside and do and get exposed to rain, we get cold. So when we are doing a head bath, nothing is happening. When we are exposed to cold in rain, we are having some cold or fever. Then we are doing Shirodhara, we are manipulating the same principle in a regulated way. Okay, so wellness is basically optimum external and internal stimulation. Illness is inconsistent external and internal stimulation. And actually, therapy is whatever therapy that we are doing is regulated external and internal stimulation. Okay, that regulated external and internal stimulation is the therapy. So whatever we are doing, Shirodhara, Shiropiju, Nasyam, it is regulated environment or stimulation that we are creating that is making the body to respond in a positive way. So ultimately, when we think therapy in Ayurveda is basically regulated stimulation or activation, challenging the body to in a very compatible way so that the body responds to this challenge. And body's response to this challenge is, it brings in functional balance to the physiology. And this functional balance that the body brings in by doing a particular procedure in a particular format is the Samyak Lakshana, which actually is the optimum stimulation and the optimum response that body gives for the stimulation that we are doing. So when we are planning for an Ayurvedic, whenever we are doing an Ayurveda therapy, there is a specific action and optimization of the procedure and the drug and medium that we are using. For example, if there is a knee joint pain, should I go for a Janudhara or should I go for a Januvasti? Should I go for Janudhara with Kotanjukadi or Murvanna, or should I go for Januvasti with Chinjadi or Kedagi Muladi? So Janudhara has got a mode of action, Januvasti has got a mode of action. If there is Pittanubandha, like Arumshika Shirasto, the Dahapaga Vraneshu, if there is Pittanubandha, Dhara is the possibility. If it is Vata plus, crepitus, no severe pain, there is, all condor gone and all, Vata plus, Shirovasti, Lavasti, Januvasti is the best thing. Now, if I want to go for more Asti specific thing, I would go for Kedagi Muladi. If there is, Sashofam in the Anubandhatam, Chinjadi will be choice. So the procedure has got an action. That medicine that we are using in the procedure actually regulating the mode of action of the procedure. Okay, so that is why when we say regardless of the drug that we use, the procedure by its action, when we are doing Pratilomam, Anulomam, it has got an action, a specific indication and contraindication. So, all our retaining or pressure, plane, vibrations, all these things, whatever we are giving, it basically brings in an action in the body. And whatever that we are doing, we are using the medicine in the procedure actually regulate the mode of action. If I'm doing a Januvasti with, if I'm doing a Janudara with the Murvanna, if I'm doing a Janudara with Dhanvandram. Murvanna is anti-inflammatory Pittana Bandhan. Dhanvandram is more of having Shira, etc. It is more of Vata Haratvam. So in more Vata plus condition with more crepitus, Dhanvandram can be a choice. So that is why the whole procedure of thing is made into a very more body friendly, tissue specific responses in the body is sought to it. So the same drug may act differently in different routes of administration. Trifla Kashayam we give in Lekanavasti. Trifla Kashayam we go for Kshalana in the eye. Trifla Churnam we make for Udvartanam. Trifla Kashayam we use for Avagaham. The same Trifla has got its own action when we are using it in different routes. So I think to conclude, I would say understanding all this procedure in terms of Ayurvedic principles is very relevant, and observing each, what you call it as, each responses of the individual to all these things in a very close way is more important, and individual responses has to be very closely observed, and it has to be modulated in a way, like in terms of time or in terms of medicine or in terms of combination or in terms of administration, etc., for the optimum response. So how we assess the optimum response? Optimum response is assessed through Samyak Lakshana. That is why Vaidya's presence in the whole scenario of treatment is inevitable. Doing therapy is not the responsibility of the physician, therapist duty, and we sit here. We must always be having an eye on how things are running and how things are regulated. So I think with this, I conclude and open the session for any questions and discussions. Thank you.
Thank you so much, ma'am, for the very wonderful session. It was very informative, especially the last slide. The therapy is the regulated internal and external stimulus. That line was really striking. So I request all of the participants to post their queries and feedback, please. Ma'am is eagerly waiting for your response. Doctors, please respond. You can post in chat box or you can unmute yourself and speak. Dr. Ananya has posted, ma'am, could you repeat why Nasya should only be done after Koshta Shodhana?
Yes, Dr. Ananya, because you see the order. Of course, in cases of Urdhva Vikara, Nasya can be done in the first site, but otherwise, always that is why Vamana, Sneha, Sveda, Vamana, Virejana, Vasti, Nasyam. The order itself say, for us, Shiras is never a separate entity than the Koshtam. Koshtam is always connected to Shiras. We have given importance to Shiras through Nasyam because of the presence of Indriyas. So only when Koshtam is corrected and Koshtam is in the normal way, the Vayu is getting, Vayu movement will be correct, Apana, Samana, Vyana, only when it is correct, then we'll be having proper Udana and Prana. That is why you could see in chronic cases of Pratishaya, even Shalakya practitioners will not be just giving internal medications without considering Koshta. Padola Muladi, Padola Kadirohini Adi Kashaya with Avipati is given along with medicines for headache, etc. So always Koshta has to be cleared out before going for Urdhva Jatru procedure. Only then we will be able to correct from the root.
Thank you so much, ma'am. Next question. Dr. Simran has posted nice session, ma'am. I want to ask that how can we plan a Panchakarma plan for patient? What is the sequence for the therapies and for how many days? Can you please specify the disease condition, Dr. Simran? Any disease?
Any disease? Yeah. Okay. Any disease, I think you have to think some problem. As I mentioned, no, we see if you have a pakvashegada, if you have a pakshagadam, then definitely you have to plan, and his speech is affected. Your treatment must start with Murtha Daila. Okay, and if you have a Prameha Rogi who is just 4 to 5 months back only, Prabhuta Mutrata and Avila Mutrata is there. We have to follow the treatment principle, that is, Stula Pramehi and Krisha Pramehi. For Stula Pramehi, Shodhana has to be done. So we have to go for a Snehapanam, Shodhanam, followed by Vireshanam, then Murtha Tailam. So if Kushta case is there, Kushta is Mityahara Vihara. So definitely both Vamana and Vireshna has to be done for Kushta. So Vamana Vireshna followed by Takradhara. So according to the severity of the condition, the chronicity of the condition, Bala of the Rogi, Dosha Dushti, and Samprapti, we have to plan which has to be the first procedure, next procedure, and next procedure. Spanning about all these factors have to be considered.
Okay, that was a wonderful answer, ma'am. Any other questions, doctors? Ma'am, in Pratimarshanasya, time need not be taken into consideration, right, ma'am? Like, for example, in premature graying of hair and all, can we do it during night time, like just before going to bed?
Yeah. Pratimarshanasya time need not be taken into
Okay.
consideration because Pratimarshanasya you have 14 kalas that has been told, no? So dosage,
Yes.
if it is less, we can do it. Nishi is a Pratimarsha kala. No
Okay.
issues at all. Yeah.
Okay. Thank you, ma'am. Dr. Ananya has posted what is the difference between Virechana and Vasti other than dosha specificity and Adhovagahara property of drug in Virechana.
Vasti is Pakvashaharam. Virechana is Atho Amashaharam. So for Vasti is Vata plus plus. For Virechana it is Pitta plus Kapha plus. So dosha difference will be there. But of course, Vasti can replace Virechana in certain conditions, which has been specifically told. No? That is why Samyak Niruha Lakshana and Samyak Virechana Lakshana are told to be same by Acharya Vagbhata. So, Ruksha Bhakwanila Krura Goshta Vyayama Shelena, Tebyo Vastin Puro Dadyat. In Virechana context, if the patient is having Ruksha Bhakwanila Krura Goshta Vyayama Sheli, he has been told to be given Vasti first before Virechana. Okay, so if Pakwash, as I mentioned, now, Vasti is the choice when the Samprapti starts with Pakvashaya and the Samprapti ends in Pakvashaya. Okay, or in the process, the Pakvashaya is involved. If Amashaya is specifically involved, our choice would definitely be Virechana, not Pakman Vasti. So, where the Samprapti have started, Adhona Bija, in Pakvashaya, then definitely Vasti has to be a possibility. Okay, so that is why in Charaka, of course, Srota Vishuddhi, Indriya Samprasadaha, Laguttamurja, Agni Ranamayatam, that is told as Samyak Virechana Lakshana, Prasrishta Vinmutra Sameranatam, Ruchi Agni Vriddhi. So in Samyak Vasti Lakshana, Charaka says Prashastra Vinmutra Sameranatam. And so Virechana Samyak Lakshana, Srota Vishuddhi, Indriya Samprasada, Praptishta Vit Pitta Kafa Nilana. Praptishta Vit Pitta Kafa in Virechana. Okay, so that has been told. Even though here prasishta vittu mutra samirananam, that pitta kapha has not been specifically added. So that is why in Virechana that Amashaya's area is getting corrected. In Vasti Pakvashaya's area is being corrected. So that is a specific difference. Yeah.
Okay, thank you so much, ma'am. Any other queries, doctors? Or else you can post your feedback because it was such a wonderful session.
Dr. Ananya, I hope I'm clear. I mean, if you need further clarifications.
Dr. Ananya, do you need any other clarification regarding this question? Yes, she understood it well. Thank you so much. She has posted. So if we don't have other queries and feedbacks, ma'am, shall we wind up?
Sure. Thank you. Thank you all, and all the very best to all of you. Yeah.
Thank you so much, ma'am. Good night. Good night, all of you.